Welcome to ICE Dental System's Dental Patient Information, a service provided by your dental practitioner to ensure you are well informed about the areas of dentistry that apply to you. This presentation covers information related to adolescent orthodontics. To advance through or review any element of this presentation, please use the index on the left side of your screen. If you are not currently in your dentist's office, you can ask your dentist a question by clicking the Ask a Question button at the bottom of your screen. Your dentist will receive this question and will be prepared to answer it for you at your next appointment. The terms displayed on the screen before you are terms frequently used in the dental community and may appear in this presentation. Take a few moments now to review these terms. We will temporarily pause the presentation to allow you time to review these terms. When you are ready to continue, click the Continue button which will appear on your screen. This presentation is an overview of orthodontics, a specialty within dentistry, and is intended to educate potential patients both on the importance of orthodontic treatment and on how to easily begin the orthodontic treatment process. This presentation will also describe the benefits of orthodontic treatment, what to expect during the process, and will identify a number of risks and limitations that may occur before, during, or after orthodontic treatment. Orthodontics, in general, focuses entirely on the diagnosis, prevention, and treatment of dental and facial irregularities. This includes the assessment and correction of malocclusion, or problems associated with having a bad bite. Adolescent orthodontics in particular can also, in addition to correcting a malocclusion, enhance your child's smile and appearance. More importantly, adolescent orthodontic treatment provides a foundation for a healthy and proper adult bite. If appropriate, your orthodontist will develop a treatment plan tailored to your child's needs, involving procedures appropriate for their individual developmental pattern. If there are risks or limitations specific to the planned treatment, these will be explained to you. Adolescent orthodontic treatment usually starts after a child has lost all of the baby teeth and has most of their adult teeth. Most children will achieve this stage in development by about the age of 11.5 or 12. The goal of adolescent treatment is to correct a range of orthodontic problems in a patient who has not yet completed adolescent growth, but who has all of the adult teeth present. If adolescent orthodontic treatment has been recommended, it usually means the child has a difficult problem that would be most effectively managed either during or towards the end of adolescent growth. If a properly recommended adolescent orthodontic treatment is not pursued, subsequent treatment options may become more limited, more difficult, and likely more invasive. The purpose of this presentation is to give you an idea of what to expect during orthodontic treatment and what will be expected of you and your child. It will also point out some risks and limitations that may occur before, during, or after treatment. It is important to understand that despite ongoing developments in technology, orthodontic treatment is not an exact science. Much of its success depends on the understanding and cooperation of the patient. Parents, too, must clearly understand what is expected of their child during the course of orthodontic treatment. Patients will achieve the best results if compliance with orthodontic treatment protocols is well respected. Keep in mind that with orthodontic treatment, like with other medical and dental procedures, optimal results cannot be guaranteed. There are numerous benefits to orthodontics, ranging from minor aesthetic changes to improved physical and emotional health. When the upper and lower teeth are aligned properly, the tremendous forces of chewing and grinding are more easily absorbed by the jaw bones, the jaw joint, and the teeth. This provides a person with a bite that will add to the long-term health and attractiveness of their teeth and smile. Most often, the reason for orthodontics will be one or more of the following: misaligned or crowded teeth. Straight teeth are easier to clean. An unattractive smile. Orthodontics places teeth in harmony and balance with the face. Proper fitting teeth. Teeth that are evenly distributed in the mouth put less stress on the tooth-supporting structures where gum disease can start. As a result, teeth will last longer. Jaw joints which function as intended, without pain. When the upper and lower teeth are aligned properly, the tremendous forces of chewing and grinding are more easily absorbed by the jaw joint. A good smile leads to greater self-esteem, improves appearance, and promotes dental health. Did you know that the first thing most people notice is your smile? Let's take a few moments now to discuss orthodontic treatment itself. The first step in determining your child's treatment plan is learning as much as possible about their specific orthodontic condition. This begins with an orthodontic evaluation, during which your child's teeth and jaw alignment will be examined. If appropriate, your doctor will then likely request a complete set of orthodontic records to comprehensively plan the most appropriate treatment. Orthodontic models, obtained through a variety of impression techniques, can be used to exactly replicate a patient's teeth, jaw form, and bite. Models of the bite will enable a quantified analysis of any given patient's presentation from a perspective not possible during a clinical examination. For example, your doctor can use orthodontic models to specifically measure individual tooth dimensions or overall dental arch dimensions in a very precise manner. This is particularly true of the 3D digital modeling technique, in which various software systems allow your orthodontist to easily manipulate or morph the models and demonstrate the potential final treatment result even before embarking upon actual treatment. This allows for all potential treatment plans to be examined and discussed carefully. Photographs of the patient's face and teeth are often taken before a phase of treatment to document a specific stage of dental development or to demonstrate a specific issue. Usually, photographs are also taken after a phase of treatment to allow for comparison of the before and after stages and to appreciate the changes that have occurred. Frequently, the corrective changes with orthodontic treatment happen slowly enough that they are difficult to see on a day-to-day basis. Photographs taken at various stages of treatment help to highlight the changes. When planning adolescent orthodontic treatment, it is important for your doctor to be able to correctly identify anticipated growth and development. For example, some of the remaining dental growth and development will likely still be occurring below the gum line and out of sight. A panoramic X-ray will allow the orthodontist to see the condition of the existing and developing roots, teeth, and jaw bones, and will also assist in the identification of any deficiencies or developing problems. A second type of X-ray, with a more generalized view of the growing head and neck, may also be requested. This type of X-ray is particularly useful to the orthodontist for, among other things, predicting growth that has not yet occurred. Once the orthodontic records have been obtained, your orthodontist will be able to make the best predictions possible and then, in turn, determine whether or not adolescent orthodontic treatment is recommended. If adolescent orthodontic treatment is recommended, your orthodontist will first determine the appropriate timing in addition to the anticipated duration of the treatment. The treatment plan will be based on your child's specific situation. The details of the pending treatment will be discussed prior to treatment actually getting underway. Your orthodontist will also discuss both the advantages and the potential disadvantages of not proceeding with the treatment as planned. When treatment is completed, it is very important the result is maintained. This is accomplished through the wearing of a device called a retainer for a period of time after treatment. A retainer does not move the teeth, but simply holds everything in place. This is known as retention. Retention ensures that major changes in the orthodontic correction are not allowed to occur in the immediate post-treatment stage. Despite retention, some additional changes will occur as your child matures and continues to grow. Some limited shifting or settling of the teeth may occur in varying degrees. Further growth after treatment may also continue to influence the alignment of the teeth and the jaws. Use of retainers following a treatment phase, as recommended by your orthodontist, is the best way to minimize these changes. It is possible to clearly identify anticipated problems with an adult bite even when the patient is of an adolescent age. Orthodontics, in general, focuses on the diagnosis, prevention, and treatment of dental and facial irregularities. This includes the assessment and correction of malocclusion or problems associated with having a bad bite. Adolescent orthodontics in particular can also, in addition to correcting a malocclusion, enhance your child's smile and appearance. More importantly, adolescent orthodontic treatment provides a foundation for a healthy and proper adult bite. When appropriate, your orthodontist may recommend adolescent orthodontic treatment tailored to your child's needs and involving procedures appropriate for their individual developmental pattern. The decision to correct an identified malocclusion or bite problem at an adolescent age allows the option of working with all of the adult teeth at an age before growth is complete. As a result, adolescent orthodontic treatment offers an opportunity to take advantage of an individual's remaining growth and development while, at the same time, having access to the adult teeth. This is where the opportunities in adolescent orthodontic treatment lie. Thank you for using ICE Dental Systems dental patient information. We trust this presentation has been informative and helpful in understanding the benefits, advantages, and disadvantages associated with adolescent orthodontic treatment. To review any element of this presentation, please click on the index items on the left side of your screen.